from a very different perspective. The citizen sees things from a very different perspective. So herein we'll be dealing with the bridge that is there between the citizen and police. And the overarching aspect of policing shall also be considered, where what are the different laws and policies that come into play while the citizens, while the people of the country are policed and regulated to some extent. So that is the basic overarching theme of our panel discussion today. So first of all, Ms. Radhika ma'am will be speaking on the status of Police India report series. So before Radhika ma'am goes, I think a brief introduction of SPIR is required. The status of policing in India report are a series of studies on policing and the state of the rule of law in India. The first such report was released in 2018. The report is a combination of performance and perception about policing through an analysis of official data and an elaborate perception survey. So it also highlights the gaps and the inefficiencies in the system that exist presently and what can be the possible solutions to solve all these issues that may arise in citizen and police interactions. So first of all, we have Radhika ma'am, who shall be giving a small presentation on SPIR. So a brief introduction about Radhika ma'am. She is the research executive of Common Cause. She is the lead researcher for the status of policing in India report series. A researcher, social worker, and lawyer by training, she has done MA with specialization in criminology and criminal justice, Tata Institute of Social Sciences. And she is an LLB from Faculty of Law, DE. She currently works at Common Cause as a research executive and legal consultant, and she has previously worked at the Delhi Police Special Unit for Women and Children as a counselor and also as a part of SEVA as the legal counselor. So Radhika ma'am, the floor is open for you. Thank you.
Thank you, Aditya. And thank you to the RGNUL students and faculty for organizing this discussion in collaboration with Common Cause. A very good morning to all. So, police or the law enforcement agency is by its very definition meant to safeguard the rule of law. And as a logical extension of this role, they are also meant to abide by the very rule of law that they are safeguarding. However, as researchers, lawyers, students of law, academics, we know that this is far from the truth. In fact, the Indian police is infamous for the level of discretion and arbitrariness that they practice, so much so that it has been argued by academics that it is not just an individual aberration of certain police officers, but actually a systemic inbuilt flaw. We saw that this was nowhere more true than during the pandemic, in which the police, during the whole period, the police used wide discretion, both for the benefit of the common people, as well as for extreme use of force for the most minor violations of lockdown. The police essentially became the gatekeepers of not just the law and order system as per usual, but of the entire public management during the lockdown. And they provided health assistance, they provided rations, they were interfacing with and also stopping migrant workers from going back home. So we find use of arbitrariness and discretion as a common thread emerging through the findings of SPIR 2020-21, Volume 2, which is on policing during the pandemic. I will go through some of the key findings that we have from this report. But before I do that, I wanted to introduce you to SPIR. Aditya has covered most of what SPIR is about. And basically, we look at the role, functioning, and performance in the performance of the police using empirical, evidence-based analysis, both from survey data of important stakeholders like the common public, the police personnel, as well as by doing an analysis of the objective or the official data sets that are already there. So we have so far come up, we have published 4 reports under this series. Let me just share my screen right now and start the presentation. so I can show you what the reports look like. So these, is my screen visible to her?
Yes.
Yes, ma'am.
Yes.
Yeah. So these are the 4 reports that we have published under this project. The first one was a survey with common people across 22 major Indian states and union territories about their attitudes, perceptions of policing and their experiences with policing. The 2019 report was a survey of the police personnel themselves, again across 21 major Indian states and union territories, and their perceptions, their attitudes, and their working conditions, problems to do with adequacy, etc. In the year 2020-21, we actually came up with 2 volumes of the report, which under the larger umbrella of policing in extraordinary circumstances. So in the first volume, which was released earlier this year, we looked at policing in conflict-affected regions. So regions which have insurgency or left-wing extremism. We looked at the opinions and the perceptions of both the common people and police in such states. In the present report that we'll be discussing today, Policing in the COVID-19 Pandemic, we looked at the public experiences, their perceptions, their attitudes towards the way that the police managed the lockdown, and also the opinions and perceptions and experiences of the police personnel themselves. So, yeah, this is the latest report that we'll be discussing today. In this report, we look at the citizen-police interactions and the handling of the crisis and the emergence of the new challenges for law enforcement. We looked at like I said, the surveys were done with both the common people and the police personnel from 10 states and union territories of India. We also have 2 separate chapters in this report, aside from the survey data analysis. One is contains the findings of a separate rapid study that we had done with the migrant workers and the relief workers across 3 Indian states, Delhi, Rajasthan, and Gujarat. So we have a chapter on findings from that report, and another chapter contains an analysis of the media coverage that was done regarding policing during the pandemic. So I would like you to note here that this report only refers to the first wave of the pandemic, because the data collection for the survey was done in October and November 2020. So all of these experiences, opinions, etc., are restricted to the first wave of the pandemic after March 2020. So, yeah. We did a survey of about 1,200 police personnel and about 2,400 common people in 19 cities of 10 Indian states and union territories. And these are the states and UTs that have, in which the surveys were done. And let me just come straight away to the findings of the report. So like I said, like I mentioned earlier, there was wide use of discretion and arbitrariness by the police there was evidence pointing to the use of excessive force and confrontation between the police and the public. As many as 29% common people, as you can see in the graph here, felt that were very afraid of the police beating them during the lockdown. And 18% were very afraid of the police detaining or arresting them during the lockdown. 3 out of 5 people feared fine or impositions. And overall, if we look at very fearful and somewhat fearful, 55% were fearful of the police beating them up. Again, these perceptions are not uniform across the country, but actually depend on your socio-economic status and position in society. The poorest, people from disadvantaged groups and migrant workers were much more likely to face the brunt of the police violence during this period, and also to have a negative perception of the police performance during the lockdown, during the pandemic. For instance, the poor and those from lower classes, like you can see from this graph, were much more fearful of the police, more fearful of the physical violence, and they were also more likely to see police's instructions as threatening. On the other hand, the police also had a negative perception of these localities. They reported that the poorest localities were more likely to be least compliant with the rules of the lockdown. Now, again, when it came to accessing basic needs during the lockdown, like ration, shelter homes, etc., the poorest and lower classes and the Dalits, Adivasis, Muslims face the greatest disadvantage. The poorest were more than twice as likely than the rich to face bigger difficulties in accessing basic needs. Another, questionably perhaps one of the most disadvantaged groups during the lockdown period were the migrant workers, especially those who were trying to go back to their homes during the lockdown. And when we asked the police personnel about the use of force, the extent of use of force against these migrant workers, about half of the police personnel admitted to frequently using force against migrant workers traveling back home. And 1 out of 3 police personnel said that they frequently encountered situations where the migrants were trying to enter shelter homes but were prevented from doing so by the police. So the police admitted to having their hands tied when it came to arranging for shelter and accommodation and basic needs of the migrant workers. We also, like I had mentioned at the beginning of the presentation, we also did a separate rapid study of, a separate rapid study of migrant workers and relief workers during the lockdown. We looked at, we did a survey, telephonic surveys with migrant workers and people who were working in the field, helping the migrant workers and other needy people during the lockdown period. Now, we found in this rapid study that about half of the migrant workers contacted for this study had faced physical assault by the police during the lockdown. So 1 out of 2 people said that they had many times faced use of force by the police during the lockdown, and that's a scary figure too. I mean, if it were to be extrapolated to the rest of the country, that's a very so yeah. Now also about 59% migrant workers and 61% aid workers were satisfied with the work of the police during the lockdown. Now we see a paradox here in the opinions of the migrant workers and their satisfaction levels with the police personnel. So on the one hand, they report having been victims of extreme use of force by the police, and on the other hand, they're also fairly satisfied with the work of the police during the lockdown. And this is a common trend across, not just limited to migrant workers, but actually across the whole. When we look at the survey findings, we see that all of the common people, all of the civilians were fairly satisfied with the work of the police. Now, this is regardless of the fact that 57% of the migrant workers and 80% of the aid workers reported frequent use of force by the police against the common people. Like I mentioned, the levels of satisfaction did not really have much to do with the use of force by the police during the lockdown. So people were largely quite satisfied with the work of the police during this period, and 86% rated the police's work as being efficient in controlling the COVID-19 outbreak. Out of which 40% said that they were very efficient in controlling the outbreak. Again, there is a notable difference in the class categories across, when we cut it across class categories. We see that the poor are less likely to believe that the police was efficient in controlling the lockdown, and are also less satisfied with the work of the police overall. During this period particularly. Now, let us also look at some of the problems that the police themselves faced in this period. And we know for a fact that this was a very stressful time for the police personnel, particularly because they essentially became the people on the roads, on the ground, trying to enforce the lockdown. Which came merely at 4 hours of notice. So they were unprepared, undertrained, and also stressed and overworked. So we see that while in usual times, during the normal times, the police personnel reported working, only about 11% police personnel reported working for 15 hours or more during the day, in a day. This increased to 27% in the lockdown period. So about 1 out of 4 police personnel said that they worked for more than 15 hours during the pandemic. And in an ironic and unfortunate sort of finding, we realized that the personnel with the existing comorbidities, so those who were more at risk of contracting the virus, were actually more likely to be working for longer hours during the pandemic. There was also very poor levels of training and preparedness amongst the police personnel. The work during this period impacted their mental health, as reported by 9 out of 10 police personnel. And about half of the police personnel said that they received training to deal with the public during the outbreak. However, a notable 43% said that they did not receive any special training to enforce a lockdown or deal with the public during this period. We also see that there was a lot of confusion about the prevalent laws and the rules during the lockdown, and a lot of police personnel in the survey reported not being sure of how the issue of migrant workers is to be tackled, what to do about the scarcity of shelter homes, etc. So overall, we noticed a trend that southern states like Kerala and Tamil Nadu were better performing states in terms of policing during the lockdown. They were more proactive in providing both training to the police personnel as well as better facilities like masks, sanitizers, whatever PPE kits, all of the essential requirements of the pandemic. And on the other hand, states like Bihar and West Bengal were the least prepared in this regard. And I think that brings me to the end of the presentation. Thank you so much for giving me the time to go through this, and I look forward to the panel discussion.
Thank you so much, ma'am. Thank you for highlighting such important perceptions of people and police towards each other, satisfaction level people with policing, experience of police during the COVID period, which is really important to understand right now because police is also going through a lot at this moment. And for shedding, and most importantly, for shedding light on this Status of Police India report of 2021. So, with this background having been set with the introduction to this report, we shall now begin with the panel discussion. First up, we have Mr. N Ramachandran. He has served the states of Assam and Meghalaya as DGP. He is a highly decorated and accomplished IPS officer with extensive experience in police administration, intelligence, counterterrorism, conflict resolution, etc. Presently, Mr. Ramachandran is the president and founder of the Indian Police Foundation. The Indian Police Foundation, that is IPF, is a multidisciplinary think tank dedicated to work for police reforms and the improvement of policing through research, capacity building, and police advocacy. The foundation is governed by an eminent board whose members include serving and retired police officers, civil servants, thought leaders from civil society, academia, media, and the legal profession. So, Mr. Ramachandran, the floor is open for you. Please. Thank you. Sir, your mic is on mute. Thank you.
Good morning, everyone.
Good morning, sir.
First of all, my greetings to the organizers of this webinar, the Rajiv Gandhi National University of Law and Common Cause. My greetings to the two eminent panelists here, Professor Ruchi Sinha of the Tata Institute of Social Sciences and Dr. Vipul Mudgal, Director Common Cause. And also, of course, the other panelists, Ms. Radhika and Aditya, who is the moderator. I represent the Indian Police Foundation, as was mentioned. And we try to bridge the bridge or to build the bridge between the police and citizens. The foundation has been continuously engaged in a number of activities connected with pandemic policing. And I will try to respond to some of the issues, observations pointed out by Radhika during her presentation, which is very well articulated and is an eye-opener for most police officers in the country. Now, coming to the topic of citizen-police interaction during the pandemic, it is very important to recall what happened in March. In fact, on 24th March last year, when the national lockdown was announced. When the entire responsibility for enforcing the lockdown fell on the Indian police, it was practically a complete curfew that was to be enforced to prevent the spread of the disease, because everyone was unclear about what exactly has to be done to prevent the spread, and the most effective way of doing it was to make sure that nobody ventured out. Now you imagine the situation of an ordinary policeman or policewoman in the field. The announcement came at 8 p.m. and their duties to enforce the curfew began at midnight. There was no time for the police forces to do any planning or prepare themselves or brief their personnel about the crisis. In fact, when Radhika says that nearly 50% of the police personnel were have responded that they have been trained, I'm I'm not very sure about this, because I mean, there was, at least in the beginning, there was absolutely no time in the early days of the lockdown. They were not even not even briefed. There was no time to even brief them. The police had no previous experience of dealing with the new role, or what is called pandemic policing. In fact, in every other situation, when the police has to go out to control a crowd or something, in those situations, always the police has some experience of crowd control in the past. But as far as, responding to a medical or a health emergency of this crisis, this scale is concerned, the police had absolutely no template to fall back upon. Government of India had invoked the Epidemic Diseases Act of 1897 and the National Disaster Management Act of 2005. In fact, when I spoke to a number of field policemen, they had not even heard about, these acts, which speaks very poorly about our training. Also, that is a separate question altogether. Now, the police was required to enforce the lockdown very strictly under these acts, together with certain provisions of the IPC and CRPC. So you can imagine the enormity of the challenge that was faced by the ordinary policeman in the field. And even about the virus itself, very few people knew much about the virus. No policeman was very clear about it. Even specialists, medical specialists, were not very clear about what was going on. And as far as basic preventive measures are concerned, most police personnel, they were given some kind of information that this is what you should be doing, but most of them were not very completely, aware of the real enormity of the problem. Now, it was not only enforcing the lockdown, at the same time, while the police had to enforce the lockdown very strictly, it was also very essential, very important that essential services and shops selling food and medicines, etc., were allowed. And the police were also required to ensure that the supply chains functioned very smoothly. Because if these things, if there were any kind of breakdown in supply chain or food supply, then there would have been rioting and all kinds of things. So it's very important to take note that in these particular matters, the police was able to make sure that supply chains were not disrupted. And mostly, by and large, people supplying the essential commodities, medicines, foods, etc., were allowed to function. There were, of course, problems. And the police were also required to protect hospitals and enable health workers to do their jobs, etc. Now, more than the police, the sudden lockdown was very difficult situation for the general public, as Radhika very brilliantly brought out. Most citizens were actually perplexed about what was going on, especially the poor people and the daily workers, the laborers. They were the most badly affected. There was a situation when, more than the fear of the disease itself, there was fear of unemployment and starvation. Many people did not understand the seriousness of the situation and started venturing out. Some of them for livelihood reasons, some of them to meet emergencies, and some of them started venturing out just without any reasons, just to look what is going on. All of you will remember that there were many instances of confrontation between the police and the public. and many instances where the police had to use or resort to the use of force, as was brought out. But overall, I must say that the police rose to the occasion and galvanized themselves very well. They deployed rapidly and acted decisively and firmly with a lot of commitment and dedication. You must have also noticed that the police were doing extensive humanitarian work as well, reaching food and medicines to the needy, taking the sick persons to hospitals, etc. In fact, during the second wave, police in many parts of the country were also required to carry out cremations of dead bodies. But the positive stories are not usually remembered. Negative stories were spreading like wildfire across social media platforms. I must once again emphasize, the police had no previous experience of enforcing lockdowns related to a public health emergency of this unprecedented scale. So most of them began to use force the same way as they would enforce curfews in a law and order situation, like controlling a rioting or quelling violence in communal situations, etc. So their approach towards this particular emergency also was somewhat similar, because they knew only one way of handling this. And so it took a lot of time for the police also to recalibrate their approach. Of course, the training and the briefing must have happened on the job. A lot of learning happened on the job. And in the beginning days, the police's own response was a little untrained and, reactive in nature. But later on, as I said, there has been a lot of learning on the job, and things started, or at least they started recalibrating their response in the days to come. But there were a number of instances where they used excessive force, absolutely justifiable levels of force. We all remember the incident of killing of a father and son in Tuticorin. It was an extreme case of brutality, which nobody can support. But in a country of India's size, we should try to gauge what has been the extent of use of force, etc. And there is, of course, the underlying problem, as Radhika initially mentioned. There is an existing underlying problem of attitude towards civilians or towards the general public, etc., which need a more systemic correction in the days to come. And that is what we are all talking about. Common Cause, and all of us sitting here have been discussing or have been trying to bring about a change in that attitude. And of course, the migrants' predicament. It was a mammoth crisis that struck the nation. That is the predicament of the migrants. You must have watched on television the tens of thousands of workers who suddenly came out to the streets looking for means of getting back home. When they found that no other sources of transportation was available, thousands of them started walking towards their homes, including women and children, covering several hundreds of kilometers. These were really heart-rending scenes. Now, when the district or city administrations were overwhelmed by this problem, The police was the only organization again that was left to control this huge human tragedy that was playing out before them. Now, whenever other limbs of the government fail or they get overrun or overwhelmed, the crisis that comes to the street becomes the baby of the police. Now, nobody talks about, officers not having officers or the political leadership not having foreseen the migrant crisis. But in fact, the labor departments of states were not to be seen. The crisis had to be handled by the police because the crisis was visible in the streets. And the police was the only player left holding the baby. So this is one issue that I thought I must highlight. Now, the other one was about some problems that affected the police themselves. And the most important was, infections and deaths within the police. Now, the very nature of policing, the duties, policing duties, are such that there can be no social distancing. Police personnel have to interact very closely with the people at very close quarters and even grapple with crowds. That is their way of functioning. Their own awareness levels were also not very high in the initial months. And in many states, we saw very large number of police personnel getting infected and falling sick. And many were dying also. This situation became a separate emergency in itself for the police. Even the very operational continuity of police became a problem in some states and in some cities. In fact, already the police in many states are very understaffed. There are states with 30–40% vacancies. Now, out of that, whatever is left, if another 30 or 40% of the policemen themselves fall sick, then there would be a huge problem for finding manpower to run the daily requirements of handling the duties. This must have been one of the reasons that in tier 1 cities, especially where the infection rates were also very high, police persons were getting infected in very large numbers. And the comorbidities, we have separately seen a number of reports that morbidities in policemen in big cities are seen to be much higher than their counterparts in the rural districts of India. This led to large-scale death of policemen in cities like Bombay, in Delhi, etc. And there were also other practical difficulties, like in the end of the day, when after the duty is over, when the policeman goes back home, he would be carrying the virus with him, and he would be transmitting the virus to other family members. So we found, in fact, the police foundation has been keeping a track of the number of police personnel infected and dying. And during the entire first wave, consistently about 2% of the national number of infections were accounted for by the police. And so far, we have information about more than 4 lakh, number of infections within the police, and 2,700 deaths. In fact, the number of deaths, we believe that would be much higher, but we have got definite confirmed information only about 2,700 policemen dying. This itself is a very large number. And similarly, the police families also got disproportionately infected because policemen were exposing themselves every day during duty, and they would come back home with this. In fact, in some states and in some cities, the police leaders started accommodating these policemen in nearby schools and lodges, etc., so that they don't have to go home. Even that was done. But then there are so many other logistical issues, like giving them food and other things. So it was a major problem. In fact, the practical difficulties that the policemen faced during this period were enormous, and we can write several books on this. Just take the example of arresting people. We hear that number of people were arrested on various things. But when a person is arrested, you can't bring him to the police station because you don't know whether he is infected. So some of the enterprising SPs, what they did was they started making temporary jails where the arrested people would be brought there and they would be subjected to medical examination, RT-PCR tests, etc. And after getting the reports only, they would be brought to the police station for further action or sent to jail, as the case may be. So this was one problem. And then, police stations are public places and a lot of people keep coming. So making sure that the infection is controlled was a very major issue. In fact, there were hundreds of such practical difficulties. Because of want of time, I don't want to go into all those details. But so I will not go into details in case there are any specific questions about the practical difficulties about certain things. I can mention them in the next session. But coming to some of the basic learnings, I'll mention only one or two. There are a number of things to be learned from the pandemic by the police, but the importance of timely communication, for example. The police were required to communicate with the people about the mandatory restrictions relating to lockdowns, about quarantine policies, which are the lockdown areas, and 100 other matters that citizens should know. Many state police people resorted to some very innovative measures to enhance their communication, and social media was used in a very big way. Also for preventing misinformation and fake news. So communication became an extremely crucial aspect of policing and administration itself. So as I was mentioning, there has been definitely a failure on the part of the administration in communicating certain matters to the people. And I must say that the migrant crisis itself got exacerbated because of a failure on the part of the respective administrations to clearly communicate with the migrants. Wherever communication failed, a kind of fear was gripping the people. And that led to thousands of migrant workers coming out into the streets in sheer desperation. But I have also come across some good examples where the problem was very well handled, where young district collectors and district SPs visited migrant camps and assured them that they would be looked after, that they would be provided with food and other essential facilities, and that there was no need for them to travel immediately in an emergency. So in those districts where the district administration went out of their way and reached out to these people in distress, those places, the migrants were reassured and they stayed back. There are a number of examples which I am personally aware of. So where there was a proactive district administration or city administration, things were better handled, and where they left it to the forces of nature, there were crisis situations. And the other very important thing is a lesson from, we all talk about community policing, some good practices in community policing. So wherever there are existing positive relationship between police and the communities, we found that the levels of compliance were far better, because the police and the citizens connect much better in those places where there are existing good relations between police and the public. It actually helps in policing in many ways, like conducting effective investigation and intelligence work. It also helps in effective preventive programs. And of course, it helps in developing trust. Now, these are basic lessons in community policing, which our police has not been able to enforce in many parts of this country. But there are good examples where some proactive officers have experimented with these and where there have been excellent results. So there are a number of lessons that the police should learn from the pandemic, as I was mentioning. And let us hope that these lessons would be consolidated and followed up in the days to come. So these are some of the basic thoughts that I have at this stage. I will answer any questions during the coming discussions that will ensue. So thank you very much for your attention.
Thank you so much, sir. I think it was really important to understand for all of us here. It was very difficult for the police to calibrate their responses to the pandemic. It was really unprecedented what followed. And as highlighted by you, the migrant crisis also accentuated the law and order issues that were arising in the pandemic itself. So I think the elaborate perspective of and the health problems faced by police personnel, I think that was the really crucial part that we miss from the citizen perspective. So connecting to the next panelist that we have here, Dr. Ruchi Sinha, I think it is important to throw some light on the society's perspective as well. So before Dr. Sinha starts the speech, a brief introduction is required. She is an associate professor at Tata Institute of Social Sciences and the chairperson of the Center for Criminology and Justice at TISS. As an educator and practicing criminal justice social worker, she has worked for over 2 decades in the field of criminal justice system, policing, crime and development, and criminal justice policy. She has a body of work on police social work and structural violence. Currently, she is a council member, State Coaching Council, with Women's India Chamber of Commerce and Industry, and on the advisory board of Srimati Kanta Ben Shah Research Center for Multidisciplinary Studies of Mani Ben Nanavati Women College. Ruchi ma'am, all the floor is on to you. Thank you.
Thank you, Aditya, and a very good morning, rather almost good afternoon to all the listeners and my co-panelists, Radhika, who has been a colleague in the policing arena, and Mr. Ramachandran, whom we've been troubling often again whenever we need to work with the police. So much of what I have to say has been covered by Mr. Ramachandran, and we need more police officers like you who are candid in accepting that, yes, there has been some transgression on our side, but also trying to give the bigger picture, the larger picture, where police is at times insufficiently seen to be the cause of the trouble, whereas the trouble is way beyond. So I'll just try to kind of encapsulate it in the 15 minutes, and because I think there are a lot of questions that are very interesting, which need to be addressed. So, if you see what Radhika has pointed out through the report and what Mr. Ramachandran has lucidly commented upon, it's very important for us to understand that policing is not homogeneous. The minute we say policing, everybody tends to have a picture, khaki or white color, whichever is the dominant picture of the police force, with a lathi, pot-bellied, etc., etc. But policing is not the individual. Policing is a set and series of activities that the individual carries out to maintain law and order and to investigate wherever the crime has happened. So essentially, what we're talking about is policing where gross transgressions have happened, policing where everyday misdemeanors happen, policing within sustained challenges, and policing without information. Now, this is exactly how I would like to structure the points that have been brought up by my two panelists before me. And I would just like to quickly draw your attention to the fact that Mr. Ramachandran has pointed out that there was no information, there was no communication. And that is where people, mostly it's the citizens, and it's often happens that it is the marginalized communities who face the maximum brunt of this misinformation. So the first case that was reported in India was on January 30th. And the Janta curfew was, announced on March 19th, and March 24th is when the lockdown started. Now, if you look from January 30th to March 19th, all the information that was given to us was what was happening outside. There was no information about what preparedness have we done. There was this sense of, joy that, we are still untouched by it. But the minute the first infection was found in India, there was no proactiveness to figure out that who all would be the frontline workers. Frontline workers initially were only the medical people. Then came the Anganwadi workers, and police and sanitation workers came much, much later. So this bias in perceiving of, perceiving who will be your frontline workers and what all do we have to deal with was the administration, largely the state governments or the national government's work, which did not happen. Now, instead of reacting to the episodes of violence that happened on the street, it is important that we respond and we try to understand where all did we fail so that in future we do not face all these problems and people do not get impacted by such transgressions by whichever state authority. Not only police, but also by the municipalities, but also by the hospitals, because you heard about stories that people were not admitted to hospitals when they should have been admitted. So all of this, in all this context, uncertainty, we are trying to discern how did the police fare, why did the police behave the way it behaved, and could we have done something differently? Now, a very interesting thing, since we've been working with police and we work with the police stations, it's important to understand there's one question here saying that they would want to, kind of take action against the entire police department. I would like to draw that students' attention that every police station has its own personality. It has its own context. So it's very important not to see it as a universal whole, but to see the subset of a police station and see how they have behaved and what have they done. And once you understand this, you will be able to make a correlation and an understanding that where was coercive policing much more and where was humanitarian action taken? And why did humanitarian action happen in one area and why did coercive action happen in another area? Once you get this basic understanding, it will be easier to mold the police or the police station to respond to citizens rather than react to citizens. Now, we sat down with the police and we tried to make a list of things that the police should have done. This we did in April 2020, and the roles that we realized that the police had to do in addition to their regular work was they had to figure out the travel history of the exposed or the infected citizens and figured out where all they had gone. So you can imagine that here we are already talking about a short-staffed police. Then they had to figure out ki wo insan kidhar kidhar ghuma. So they were literally calling up people, sir, aap kab aaye, kahan gaye, kis se mile, and then kis se mile, unka number liya, and then figuring out that wo kidhar kis se mile. a very, very tall order for the police to do, and no extra information given to them. Everybody using their own mobile phones, reimbursement of mobiles out of question. Okay, then they had to coordinate with the medical teams for quarantine facilities so that they could inform people and also keep people informed that where is it full, where is it available, where would it open up, where are the new quarantine facilities coming. Everything was being given by police. There was no portal giving us this information. Then arranging vehicles for emergency cases. Now, very interestingly, you all know what is the status of police vehicles for their regular bandobast duty. Now, to arrange vehicles, was there any contingency money given to the police stations? Definitely no. But still they had to arrange. And when they did not arrange and when there was no response, there was critique of the police. Then marking hotspots, communicating to the health department and the municipal department. Every time the police station was communicating, sir, idhar itne cases बढ़ रहे हैं, health department say municipality ko bolo, municipality would say health ko bolo. So the poor policeman, and mind you, these are all assistant sub-inspectors who are constantly trying to communicate to each other and nobody taking responsibility. So they were busy doing that. On the sidelines, they were busy ensuring that essential and public supplies continue, that Mr. Ramachandran pointed out. That was very, very important. And if you remember the first 2 months, panic buying, shops getting emptied, things not being available, that also had to be addressed. And that was largely on the food and supplies machinery and the police machinery. Then guarding the medical staff. So as it is, they are overwhelmed with guarding the VIPs, which takes half of the attention of the police department, and now guarding the medical staff. And also enforcing social distancing wherever they were on bandobast duty. Now, interestingly, you have to enforce social distancing without following social distancing yourself, because the population ratio in certain communities is so high, you can't go to a slum area and maintain social distancing. Now, can you imagine the kind of pressure a policeman, a constable to a sub-inspector to even a police inspector is undergoing when he is being told, aapko karna hai? And at that point of time, the first 2 months, the police was not provided with masks also. So they had to make their own arrangements. Now, this is the kind of exposure that the police underwent. And at the same time, all that they were hearing was the police is not doing its job. On the sidelines, they're doing all this. They were probably not doing it as best as they should be able to do it. But in a given context, I would want every listener here to tell me, would they be able to do better than what was done at that point of time? Prospectively, now we say, yes, it could have been done better. At that given point of time, I am not so very sure in the given confusion that existed. And then amongst all of this, now this is extra work that they're doing. We were also getting news reports that police is getting attacked. So you must have heard on the media that there were police in Punjab, Calcutta, Telangana, Orissa, MP, UP, Maharashtra, Tamil Nadu, Assam, where police was getting attacked, and some of them were attacked quite seriously. Okay, you must have heard about where a policeman in Punjab, where his hand was cut off. So there were certain costs that the police have borne. And this all happened because there was no clarity, as again pointed out by Mr. Ramachandran, that which law is in operation. So everybody was talking of different laws. We know about that because we were constantly trying to figure out that how do we come up with a protocol which the police as well as the government could follow. Now, mind you, you have a disaster management unit, you have a full administration, municipality, as well as civic affairs, and the police administration. And the laws that they finally dug out was the Epidemic Disease Act of 1897, then the Disaster Management Act of 2005, and obviously the most famous section of IPC, that is section 188, sorry. So all of these were being talked about. Everybody was talking about, but nobody was fleshing it out, that what prevails in what conjunction, who uses what, do the doctors use this, do the police use this, if the police uses it, does it do it with conjunction with this general administration? There was no clarity. And I know this for sure because every time the police would call up and say, Madam, isko hum kya kare? Logo ko kaam pe jana hai, wo bhook se mar rahe hai. These are questions we have faced from the police. They wanted to respond, but they didn't know how to respond. Okay. So Then finally, at the end of April, May, June end, they came up with, different states came up with their own disease acts. So we had the Delhi Epidemic Disease COVID-19 Regulations 2020, you had the Maharashtra Epidemic Disease COVID-19 Regulations, so on and so forth. But largely, the good practice was seen in Kerala, where they collapsed different policies and came up with a central policy. So it gave freedom to the administration and to the police to use the finances as well as the rules and regulations of different policies, different acts together. So that kind of helped the administration to respond positively. That is where you heard a lot of good stories or positive stories coming out of Kerala. Now, largely what we noticed was that there was a lot of confusion regarding the restrictions, the exemptions, the passes, the violations, the legality, and the kind of authority that one could use at this given point of time. So the restrictions during the curfew, restrictions in 144, and restrictions in the lockdown, all of these were very, very confusing. And every time people were using WhatsApp forwards. So now this WhatsApp forwards became another headache for the police because they had to police all of this. And if you remember, in July, August 2020, there were these flurries of recommendations saying that, WhatsApp administrators are responsible, etc., etc. So I hope you're realizing that one by one, there were additional responsibilities being given to the police without additional support. Okay, so finally, after all of this, it is somewhere at the end of August that the Disaster Management Act 2005, Chapter 10 was invoked with offenses and penalties. Now, what I want to draw your attention to, that we are drawing attention to offenses and penalties. What does that communicate? That the civic administration as well as the criminal justice administration was again looking at a curative approach, not at a preventive approach. There was no guideline that this is how you have to behave, this is what you can do, this is how public can be managed. So overall, if you see that there was no role clarity, because of no role clarity, there was a lot of moral that was down of the police because they didn't know where to go. So if a police officer from the police station went to a higher up, the higher up could just listen to their, the way they were being treated, the apathy that they were facing. But in the end, they said, do the best you can. Now, when you are doing bandobast and when you are doing in so-called lockdown, the training that has been given to the police at this point of time is, jab sarkar ne bola hai ki koi nahi to koi nahi. Now, the police expects that when they go up to a citizen and they say, bhai, tum sadak pe nahi dikhna chahiye. Now, the police has also come across certain situations where people are taking fake prescriptions and walking on the streets. Now, to discern between a fake prescription and an original prescription, it's not the job of the police. They should have been able to do it, but in that given exigency, were they able to do it is a question. But at the same time, was there a guideline given that if a person with a prescription is walking on the road, how do you respond to it? No guidelines. Now, some police officers used their discretion, some police officers did. Some followed the rule of law, some followed the principles of humanitarian service. So that is where we got an idea that there is a thin line between being strict and rigid and between following the guidelines and yet giving individual this freedom to discern where and how which individual needs to be supported. There was very weak interdepartmental communication, and as a result, what emerged was that the police realized that this cannot be done in isolation, and they started partnering with civil society organizations. So again, in Maharashtra, that's where I have the maximum experience from. We saw that the police station started reaching out to all community level organizations, saying that if you know of people who need help, please reach out to them and we will facilitate. And each senior inspector had given their own personal number to the civil society organization that if you face any problem, please reach out to us. So at a great level, it was the personal interaction or the personal correlations between civil society organizations who were working in the area or who were working with the police, who managed to somewhere reach out to the people who were marginalized. And as was pointed out, that there was certain increase in certain uh, crimes, so violence against women. And here I would like to point out, I personally had this case from the police station. A police officer called up at 3 in the night, said, "Madam, ये औरत को मैं घर नहीं भेज सकता हूँ, अभी कोई गवर्नमेंट फैसिलिटी नहीं अवेलेबल है, सब RT-PCR टेस्ट मांग रहे हैं. If I send her back home, she will die. I need to send this woman somewhere. And I can't keep her in the police station because it's against the rules." So then we quickly, we called up a Gurudwara and we said, "Can you please keep her?" And the Gurudwara said, "Without RT-PCR." Then we kind of, negotiated, keep her in an isolated place, etc. So the woman was provided shelter and food, and the police took regular update of the lady. And as soon as her RT-PCR test, again arranged by the police, not arranged by anybody else. Now, police had no kitty to themselves where they could have arranged RT-PCR, but they arranged. They ensured that the lady was safe and then negotiated with the civil society organization and gave a safe space to that lady. Another police station where there was this woman, an aged woman whose son had deserted her. She would go to the police station before the COVID every day, dua salam karke, and say that, and go back to the community and say that, I have connections with the police station. So before the COVID, anyways, the police station was happily, dealing with her, "Ji Mataji, ha Mataji," and giving her a cup of tea in the morning. Once a lockdown happened, you won't believe it. There was one person from the police station going to the lady's house and giving her food and saying, "Mataji, abhi mat aana, tumhare bete aa rahe police stations." Another police station where the children were in America and the mother, a senior citizen, at home alone. So he wanted to send something for her birthday, but it couldn't happen. Now, when all the shops were closed, the police arranged for a cake, went to the lady's house, told her, "We can't come in because, we might be carrying infection. Please cut the cake, give us a piece. We will send a picture to your son." Now, these are the stories also that I have seen from the police station, and these are individual stories. So if I collate all these individual stories, one understands that policing at a personal level has attempted to be humanitarian. Policing at a systemic level, because of many reasons, not only because of police, has failed to be as humanitarian as they could possibly be. Now, the fact here is that, do you write off the police administration or do you engage with the police administration? We learned from here is that the police needs to be trained, to be ready to take on different hats, to wear different hats in different exigency situations. Because police, as one police officer very, very, in a complete frustration told me, "Madam, give me a dead body, I know how to deal with it. But here you're giving me a live body who could have the potential threat of a virus. I don't know how to deal with the invisible enemy. So now what are you expecting me to do?" And I think that was a real cause of anxiety for everyone around. So instead of targeting them, in targeting the police, is there a way of retrieving the good that is there in police? Obviously, punish the ones who have transgressed completely, as the Tuticorin episode says, but there are episodes. And in the end, remember, police are also human beings. So just because they're wearing that uniform does not mean that you overlook that problems that they face. And the second report of Common Cause, which brings out the systemic challenges that police faces. Every time the police is faced with a situation, they are expected to respond. But if you do a behind the scene analysis, you realize they do not have the system supporting them to do their job efficiently. And my last sentence here is, every year my students used to be placed in police stations. They used to go to police stations saying police is bad, it's corrupt, it's horrible, it doesn't work. And every year they have graduated saying that this placement has changed my opinion. They work very hard, and given a choice, I would probably not be smiling, laughing, and being so helpful to people in the circumstances that they work in. So look at the reality, look at your expectations, look at how the state is owning the police services, and then do a responsible critique of the service and help the police deal with the circumstances that they are faced with. And the most important here is the political influence under which they are being forced to not act the way they would like to act. With this, I will end. Thank you.
Thank you so much, ma'am. Thank you for highlighting the need to understand the difference between responding and reacting to any particular issues. it also becomes essential to understand that there was lack of preparedness and proactiveness in responding to the whole pandemic situation, and how, as Mr. Ramchandran also highlighted, that there was lack of preparedness or template to follow for the police. I think it was really important to understand this, to know that though there was some inefficiency, that was due to the systemic problems that were arising. And as very aptly stated, that there was difference between policing at humanitarian level and policing at the systemic level. So it does change the society's perspective when we see it from, when we understand these small differences, and that's how the perspective changes. This I request Dr. Vipul Mudgal to continue with the panel discussion. Before that, a small introduction for him. So, Dr. Vipul Mudgal, the Director and Chief Executive of Common Cause and IM for Change, is an activist, journalist, and media scholar. He has been a resident at Hindustan Times in Jaipur and Lucknow, a senior editor at New Delhi, South Asia editor at Asia Times Bangkok, and a BBC journalist in London and Delhi. With a doctorate from Leicester University, UK, as a Nehru Fellow, he specializes in media coverage of terrorism. He also heads the Inclusive Media for Change project, that is IM for Change project, which collates ideas and information on India marginalized. Earlier, he was the founder director of the Publics and Policies program at Delhi-based think tank CSDS. In 2020, he was a Reagan Fascal Democracy Fellow at the International Forum for Democratic Studies in Washington, D.C. With this, Dr. Vipul Mudgal, the floor is open for you. Thank you.
Thank you very much. Thank you, the organizers, Rajiv Gandhi National University of Law, its flagship journal. I'm really looking forward to seeing the journal at some point. I'm very impressed by the organizers, the way you did, and what a presentation, Professor Ruchi Sinha. I'm really delighted to know that you have directly worked in some areas. And whenever you speak to somebody who has the sounds and sights and smells of people, who were sufferers, who were victims, you have completely different perspective. And Dr. Ramchandran, he's like, I tend to call him Professor Ramchandran because he's like a professor of law to me. And thank you very much. I will come to my point slightly indirectly. I'll first talk about Common Cause because I'm talking to law students. Common Cause works on probity in public life and rule of law and governance reforms, and SPIR and India Justice Report are both a part of that mission. Okay, the rule of law mission, which is part of the portfolio of programs that Common Cause does. Now, a small word about the prominent cases. You must see, actually, whenever you get the time, just go to the website and see what are the prominent cases. About 15 years ago, the political parties in India did not submit their income tax returns. There was no requirement to getting them audited. So Common Cause had filed a case, as a result of which they started actually keeping the record books. Then there is a case on criminalization of politics, which is languishing for a long time. It'll be very interesting for you to see why is the case languishing and what have been the landmark court orders which are unimplementable, like, finishing of a criminal case against a politician within a year. There have been cases like, the petitions filed by us, like the 2G spectrum, like the coal allocation, like the CBI appointments, like the scrapping of the 66A of the IT Act. There has been a landmark case which you would be interested in, which is about the human being's right to die with dignity. It's a case referred to as the living will case. And then there are cases challenging the sedition. The case for challenging the electoral bonds in India has been filed by ADR and Common Cause together. So please come to the website and also see if you can also look at internship opportunities, etc. Sorry for, blowing my trumpet here, but listen, this is what we do. We want more of you to understand what we do and why we do. Let me start by saying that for us, I'm neither a lawyer nor a law professor. We are like very ordinary people. We just do, and that is most of Common Cause. Our members are just public-spirited people who believe that law is a branch of common cause. Law is a branch of common sense. Whatever we do, we do from the point of view of common sense. There's a tongue twister because the common cause, common sense come together, and so we let me start by giving you an interesting example from my backyard. I live in Gurgaon, which is in Haryana. In Haryana, it's a kind of part real, part hypothetical case in which an upper class girl and a lower caste boy were in love, and they decided to elope, and the whole village was against them, and they were caught and they were brought back to the village, and the entire panchayat gathered. Everybody who was to have been there was there in the village, and there was a big meeting, and everybody was asked, what is your view, what is your view, what you think we should do. And finally there was raising of hands, and they were asked, what should we do with these people? And 98% people, with like complete seriousness, with their informed choice, said that they should be hanged to the neem tree under which the meeting was taking place. Now, I have a question for you, law students. Was it a democratic decision? You see, everybody was asked. Everybody was given chance to speak, and everybody had an informed choice, and everybody gave a considered opinion that they should be hanged to the nearest tree. So now, I mean, the answer I know is not easy, but the fact is that it is not an ethical decision. It is not a good decision, definitely not a correct decision, not a constitutional decision, not even democratic in the sense that it is not coming out of the constitutional morality or constitutional conduct, but at the same time, it is a majority decision. So the lesson that we learn is that majority or majoritarian view is not always democratic, and it is very important for us to know. And then you look at the Constitution of India, and you all of you know it much better than we do. You poured over the preamble, and where it begins with the operative word justice. That is where we take our strength from, and that is what all the work that we do, including our work on rule of law, and hence the SPIR process, actually comes from there. And we believe that why you need it. You need it because the common sense says that you need it. And what is the common sense? That all of us, our interest, or all of us, by the definition of what is good for us, is not necessarily what is good for me or my family or for my community, but what is good for everybody is actually finally good for me and my family and my community. So to say it very simply in the most commonsensical way is a saying in Zulu language in Africa, and which the word is Ubuntu. And all of you know it. Many of you, it basically means that I am because you are. Okay, so it is this commonsensical approach that we follow in Common Cause, and we basically derive our strength from there. We believe that the rule of law is the spirit of democracy, and it is not possible without justice, without a sense of justice. And then let me say two more things here before I come to my point. One is, all of us believe that as a civilization, India is a great power, great country, a great power in the waiting. We are going to be definitely an economic, political, ethical, superpower in the world. There is no doubt about it. But take my word, India cannot be an economic superpower on this worn out criminal justice system. We have a grand constitution. We have come so far. At the strength of this constitution, there is a justice system working, apparently. But we cannot become a first-rate power with a third-rate criminal justice system. And what is happening is that it's not just the police, okay? It is the police, the judiciary, the entire system of giving legal aid, the entire system of prisons, and the entire system of policing. So all of it are so intertwined, and they are so well enmeshed with each other that they are actually inseparable. It's very difficult to say where one begins and the other one finishes. So we have to see the entire criminal justice system in its entirety, and that is where, when we talk about police reforms, we talk about criminal justice reforms as part of, the overarching theme under which we look at police reforms. So I would request all of you to go through the reports, to SPIR reports in the past. They are all available in public domain. You can go to the Common Cause website, you'll find it there. And another report called India Justice Report, which is a joint effort of many organizations all over the country together. Common Cause is also part of it. And see, it will definitely broaden your horizons. It will give you some very interesting questions to ask, and a new direction that common sense is the spirit of law. All citizens can understand law. It is not some Ved mantras that people come and say there is 155.3 and 156C and this and that. And, suddenly nobody understands. No, sir. You look at carefully, it's all common sense. Nothing is above common sense. And if it is, there is a question mark there. Why is it there? It is for our common good. And with that, I come to the kind of learnings of the policing during the pandemic, and what we saw as an organization, as partners, as talking to different people. And we were seeing that, the survey as a method was like inadequate. We needed much more. But you can't go by hearsay. You still have to talk to people in a systemic way, in a systematic way, in a methodological way, where you can say that this is what the law enforcement agencies themselves believe in, this is what the citizens believe in, this is what was going on at that time, so that it is verifiable. So ultimately we saw that this was like everything came down to something called discretion. And I'm very happy that I heard Professor Ruchi Sinha today. You talked about no rule about, nothing was told to police officers about the medical prescription. Now, a police party stops somebody going in a Honda City car and asks him, he says, "Maa ki dawai lene ja raha hu," and shows this thing. He said, "Jao." Another two people coming on motorcycle, first, "Kahan hai tera helmet, kahan hai ye wo, वगैरह वगैरह," and they said, "नीचे उतर जा, पहले नीचे उतर, गाड़ी खड़ी कर, इधर आ," and then ये कौन सा पर्चा है, कहाँ से आया पर्चा, the same पर्चा. And then there's a boy going on a bicycle saying, "माँ की दवाई लेने जा रहा हूँ," सीधा पहले झापड़ पड़ गया. उसके बाद पूछा कि तेरा पर्चा का, इसे पर्चा है ही नहीं. तो कैसे दवाई लेने जा रहा है, वो मेडिकल स्टोर वाले से पूछूंगा, वही देता है दवाई. Don't you know that in India, a very large number of people get their medicine from the medical store? They don't go to the doctor. They don't have the time. And there is a pandemic going on. Everybody knows which medicine to give. I mean, this is how my common sense tells me, if I'm a poor person and I would save every penny for the next meal, and I'm not going to go to a doctor or RT-PCR test or whatever. So here comes the discretion that, there is an inbuilt system where I'm not saying that you are, you did not take any money from the Honda City guy, but he's more believable. When he looks at you, he looks into your eyes while talking to you. He's talking in all sincerity. He's not pissing in his pants looking at the policeman. He talks with confidence, and you like it. And he said, "Theek hi keh raha hoga," and you let him go. And so there are these prejudices which are inbuilt, and these prejudices play out at extraordinary times. So these are things that we collect as we go. Another observation that I had, I mean, it's not my observation, everybody in the world saw it, and probably it'll be part of the history books and law books, and probably you guys would remember and talk about it if you become teachers to your students. If you are lawyers, please mention it as many times as possible, that the Solicitor General of India said at one point of time that there is no one on the road, sir. And there were millions of people on the road. I mean, they were at that real time. There were WhatsApp forwards of real videos of people walking, trudging through highways without chappals. Children going fainting on the road, and the highest law officer is telling the highest court of the country, sir, there is no one on the road, and the court believes it. So I think is it the failure of policing? It's the failure of the entire criminal justice system. It's the entire justice system. What have we come to? So pandemic to bahana hai. What is going on is like, stark in front of us, and we see that the courts have got into the habit willy-nilly of believing the government. They should believe the government, because after all, the government is the kind of guardian in moments like this. It is their job to do this. But sir, you need to ask a question. So then the third point that I want to mention here is that again, what Mr. Ramachandran also said several times in various different ways, that where was the rest of the government? Where were the other branches? Where were the revenue officers? Where was the district magistrate? And he also said that wherever the district magistrates were present, they had the commitment, they had their feet on the ground, it made a difference. So I think these are extremely important things, and it ties up directly with what Professor Ruchi Sinha said, that look, you have you have the administration, you have all the possibility of bringing them together. You could have created a template of a control room where the tehsildar was there, where the other revenue officials were there, where the other departments were there. You get the teachers every time there is a census or there is any other government this thing. You could have invited them on kind of voluntary basis. You could have got other people to come together and do, as Professor Ruchi Sinha said, some bandobast. You can give your gadi to the police for, you can ask RWAs to be part of it rather than behaving like dictators. They were so get the community together. And let me just mention once again that Mr. Ramachandran said that wherever the community participation was good, the difference was there in front of you. Everybody could see that there was a difference. So the lessons that emerge, are that the rest of the society just withdrew, and all the other branches of the government actually withdrew. I work very closely with a group called NCPRI, National Campaign for People's Right to Information. And they were constantly filing RTI petitions asking, when will the court open? When will the ration shop open? When will we get the ration? Where is it going? Etc., etc. But the entire RTI system had become defunct. So there are no courts happening. There are no RTIs happening. There are no revenue officials to be seen anywhere. What you see, only the police. It's very fashionable to say, we say in every report that police is the face of the state. But, for God's sake, all others don't have to just disappear. They have to come to the aid of the society. Everybody, I mean, the disaster management, I think it was never understood in this sense that disaster, it's a national disaster. Everybody has to rise to the occasion. You have to get, if you have a situation like this, if you have a control room where the tehsildar is, remember, the person who knows how many people have migrated from which village, who has the best resources to know it, is the tehsildar. So you know where people are coming from and where they are going. So the migrant workers, if one is a lack of SOP for everything, if you had an SOP, like if there is a prescription, what to do, if there is no prescription, what to do, and when to use your discretion or not. If there was that, let us suppose that there was no SOP, no standard operating procedure was there, what prevented the police system or the BPRND or the Home Ministry to ask an organization like Indian Police Foundation, which has done many SOPs for them, to please give us an emergency SOP? They could have got together all best minds of the country and given you an emergency SOP. There is an SOP for crowd control, apparently, which is never used. The SOP for crowd control says that before using force, you have to talk to those people. So there are various things in that. We can talk about it at some later point. But if there was no SOP, nothing stopped, some visionary leadership at central level to actually, to create kind of emergency SOPs and to give them instructions. And I completely agree with Mr. Ramachandran that actually they may have been briefed by their seniors. And when we asked them the question that were you trained, they said, हाँ जी, हमें तो training मिली थी. So वो आधे घंटे की training मिली थी. वो, one good IPS officer stood up there and said, हाथ उठाओ, ये करोगे, नहीं करोगे, हम सब चलेंगे. That kind, and they thought this was training. But it is a so definitely I completely kind of take the point there that the lack of training, the lack of legal understanding of the issues which law is being enforced. And 30% police officers said in our survey that they were not able to follow law. They said that there was no, I mean, it was like with a smile, I'm sure, that, sir, aap law ki baat kar rahe hain, yahan jaan ki padi hui hai. So it was a situation like that. You don't have to follow the law. The 1 out of 3 police personnel, they said, as Radhika had pointed out, that they were not being able to follow the legal procedures completely. I mean, obviously, you ask them, were you able to follow a little bit or more or less, in maintaining law and order and investigating any crimes during the lockdown? What were the... So I think this is quite a serious finding that, look, if you can't follow the law, then what do you follow? You follow discretion. You follow your good mind. There is a report from Madhya Pradesh which says that the same police party goes to a mosque and says, chalo bahar, sare log bahar niklo, danda lagati hai, 3-4 logon ko utha bhi leti hai. Or, the same guys go to a temple, they take off their shoes, go inside, take the prasad and tell the people to clear out the temple. It's completely different treatment. So in fact, I was trying to take notes when Professor Ruchi Sinha was speaking, and I, as a student, like most of you, that it is like your kind of treatment to you depends on where you come from. Where is your police station? Police station has a personality. So if you are in a certain area, and I'm 100% sure that if you are in the area of poor people, if you are in the area of the most marginalized, slum dwellers, tribals, then perhaps a completely different kind of laws kick in. And that is the second major finding of the report, that the poorest and the lower classes were more than twice as likely as the rich to face a lot of difficulties, not just vis-a-vis the police, but vis-a-vis life in the pandemic. How do you access food? You just call up. I mean, if I'm a middle class person, I just call up my local grocery shop and I get my supplies. There's absolutely no issue. The person trusts me. I mean, after all, I'm a rich person for nothing, not for nothing. So I get my supplies, and my supplies are delivered at my home. But a poor person has to go. A poor person maybe has to take has to plead with the shopkeeper to give him some udhar. So it was differential policing for the rich and the poor. There was a clear class divide in the perception of the police during the lockdown. And I think, no marks for guessing. This is not something that you need to spend a lot of money to find out. But the fact is that if it is happening at the systemic level, if there is physical violence, with people who are, who come from the poorest sections of the society, then I think there is a serious problem. Then again, a large number of, when you ask the middle class people that, did the restriction and lockdown rules apply equally to everyone? So they answered, I will say भोलेपन से उन्होंने जवाब दिया मिडिल क्लास के लोगों ने, हाँ सर सबके लिए एक ही सा था, because they don't know how the poor live. They have actually have very limited understanding of, you ask somebody how many tribals in the tribal settings, or how many scheduled castes or how many slum dwellers intimately or personally. Perhaps they said what they know, and that is that the rules of restriction were applying uniformly, equally to everyone. This is the middle class response. Good number, 62%, 70%, 75% of them saying so. And when you go to the poor, they said that, sir, some people got away more easily. We did not. So who are these people who got away more easily? Once again, I'm not blaming. I'm a middle class person. If my child goes out, I don't want him to be beaten up just because a poor person was beaten up. I want my child to come back after buying the medicine. So but at the same time, this kind of differential treatment was like, this discrimination is inbuilt. We see it more during the pandemic because it comes starkly in front of us. Nearly 1 out of 2 police personnel, they said they frequently used force against the migrant workers. They said कोई तरीका ही नहीं था और कोई चारा ही नहीं था. Migrant workers के लिए force का इस्तेमाल करना बहुत जरूरी हो गया था. They also, we spoke to many people, and mind you, it is not, when the minorities were mistreated, it is not just one area or the other. It was not BJP versus Congress. It was even in Congress ruled states. In Rajasthan, when the Tablighi Jamaat thing was going on, everybody was like, the social media was like, it had graduated from a media to a media university. It is now a full-fledged university. We learn most of what we know, at least quite a good number of it, from the social media. So at that time, there were these forwards going on. Some of them were absolutely ridiculous. Some of them were completely wrong. They were saying that they attacked the policemen. In fact, they came out like lambs when they were called to come down, and they went wherever they were taken. In fact, there was a friend of mine who lives in Southeast Asia. I have worked in Southeast Asia for a long time. He was telling me that from Indonesia, a large number of people had also come who were, to take part in a Ramayana festival, which was going on somewhere in Madhya Pradesh around the same time when the Tablighi Jamaat guys had come. So, he was saying that, look, it is highly possible that when they were applying, Hindus and Muslims were applying for visa in Indonesia, perhaps they could have stood in the same line, in the same queue, So the Tablighi Jamaat, when the Tablighi Jamaat thing was going on in Rajasthan, the Muslim fruit and vegetable sellers were told, when there is a relaxation in curfew, you will not come out. Rajasthan is like 275 kilometers away from the Tablighi Jamaat where the incident happened. So there, a poor Muslim fruit seller, and when they came out, one policeman asked his name, and he said, "तुझे मना किया था, तुम लोगों को बाहर नहीं निकलना," and he upturned his cart. Like, what tragedy, that all your money, all your future kind of whether you'll eat or not tomorrow depends on what you have on your cart. And your neighbor can go out and you can't, because the policeman believes that you are one of those people spreading coronavirus, because he's also seeing the same WhatsApp university lessons. So the discrimination and the prejudices which are inbuilt in the system, they were coming out more starkly during the pandemic, because partly because they had no other way, and partly because we were seeing, we are now trying to understand, trying to draw our lessons, what happened. The migrant workers, I mean, the more you come to know about them, the more you feel heartbroken that the assault was like very, very common. Knowing that these people are walking without water and without food at many times when they were kind of provided, or they arranged for themselves some kind of shelter, in a school or in some place, they were prevented by the by the police, from entering those shelters. So now, and I'm once again very, very fortunate to have heard both you, Mr. Ramachandran, and Professor Ruchi Sinha, that you actually mentioned that there is, and very clearly kind of demarcated for us that whenever it came to personally doing things, they were likely to be humanitarian. And whenever it was systemically, it was like a failure because there was confusion. I think that sums up in many ways. So what do we come down to? Basic lessons, the same lessons that we've been talking about for a long time. In fact, I would say that as what have we learned in the entire process of doing the SPIR reports, not just this report, but all the reports, that we have done so far, is that there are certain patterns and practices which are emerging, which have become almost like written in stone, that this is not likely to happen, but this will happen. Discrimination by the police of the scheduled caste, scheduled tribe, the poor, the Adivasis, and the Muslims is almost a norm, unless you are rich. If you are rich, tribal, and that's a different story. But most of them are actually poor. So the discrimination by the police is a pattern. It is a practice. It is an accepted fact. Lack of professionalism in dealing with people, there's no doubt about it. Does anybody tell you, is there any SOP, is there any training to tell them how to deal? Let's forget about us, for normal people, say how to deal with the disabled, how to deal with the mentally challenged people. Is there any difference between treating just another passerby or the homeless person? Should we have a different yardstick for the most vulnerable and the poorest people? You will see in more and more in the SPIR reports that when it comes to disposal of cases against SC, ST, Adivasis, or against women and even children, the disposal becomes even more difficult and it takes more time than a normal cognizable crime case. So these are patterns and practices which are emerging. Lack of professionalism is one of them. The prejudices which are there, the political interference which is there, the biases which are written into the system. Again, the custodial deaths are directly connected with something called torture. Listen, out of 100 people tortured, about 5 or 6 die. So the custodial death is to be seen as a torture gone wrong. You know, imagine the Tuticorin father and son that Mr. Ramachandran mentioned. You know, brutally, they were brutally and inhumanly treated. And when they were asked to stand up, they stood up and they were asked to clean their own blood. कि ये इतना गंदा हो गया है हमारा थाना, इसको साफ करो. They were provided a broom and a bucket, and they cleaned their own blood. And then one of them collapsed and they said, take them to the police station. You know, now this was, according to us in a systemic level, this is a case of normal torture gone wrong. If they had not collapsed, they would have probably gone home and died after 3 days or 4 days or maybe 10 days. It would not be a case of custodial death. You know, it's very difficult to prove that they were even beaten up there. So this is a pattern. Torture is a pattern which leads in extraordinary situations to custodial deaths. And we must understand India is a signatory to all the, you know, lofting kind of overarching international conventions against torture, but we do not follow those here. So these are the patterns and practices which are emerging. And the last one I'll mention, we will actually have sooner or later one report on just these things together. Indian Police Foundation is working on internal police reforms in areas where they can make a difference. And if you guys want more, you can actually write to Indian Police Foundation or write to Common Cause, and we'll tell you more about it. So the last point is the botched up investigation. You know, in investigation, the forensics are pathetic. BPRND has made some norms, some benchmarks that you can, you know, have these many forensic labs in every district. There should be a mobile lab. There should be this and that. But ultimately, every sample goes either to Hyderabad or to Chandigarh. And, you know, you see SPIR reports to see how many of these are there in Bihar or how many of these are there in Uttar Pradesh and other places. So these are the patterns and practices which we have to see. And in investigation, the last point I'll mention is that the witnesses unwilling to come forward and cooperate. Now, it is such a deep pattern that the witness, you can take it in writing that out of 20 or 50, I was just exchanging notes with somebody who had just visited Lakhimpur Kheri, where there are like hundreds of victims, hundreds of eyewitnesses to, you know, a police jeep which kind of mowed down people. But again, how many witnesses will cooperate? Probably 3 or 4. And if it drags for a very long time, many witnesses will turn hostile because we don't have any witness protection system. But let me put this aside and say that how in SPIR we have found that it's not just the witnesses who are unwilling to cooperate. Even victims are unwilling to cooperate. Now, this is surprising. I'm the one who has filed the FIR and I'm unwilling to cooperate. Just wait a minute. You know, I want justice to be done. I'm the one who's taken the courage. So why am I not willing to cooperate? So you see in SPIR that a very large number of victims are also unwilling to cooperate because they have lost faith in the investigation. They have lost faith in the entire criminal justice system. And this is what we were seeing constantly during the pandemic. And there is no doubt that the good policemen, good officers, you know, behaved in exemplary ways, imaginative, innovative, everything. But as a system, the policing and the justice system actually failed us. Thank you.
Thank you so much, sir. I think several important questions were raised in relation to accountability and responsibility in the system itself. Whether the aspect of discretion to be exercised. Yes, Radhika, do you have something to say?
Yeah, sorry, I just wanted to come in for a minute. I just wanted to let everyone know that I've put the link for the report in the chat box if you want to download the pandemic report. And you can also visit the Common Cause website to download all of our previous reports. You'll get all the detailed findings that Vipul mentioned and that were mentioned in the presentation.
Thank you, Radhika, ma'am. Yes. So as Dr. Mudgal also highlighted the aspect of yes, Dr. Mudgal, you have something to say?
Yeah,
Yes.
I actually just
Yes, yes.
wanted to mention a small point. Yesterday, there was a release of a report by Nalsar University and by Center for Criminal Justice Reforms. It is called Extinguishing Law and Life, Police Killings and Cover-Up. It is available in public domain. If you go, you would see it's a report on fake encounters. And I mean, it'll be, eye-opening. Thank you.
Thank you, sir. Thank you. So, as the aspect of discretion has to be exercised by the police personnel and concomitantly the differential policing that results due to the discretion to be exercised by the police. I think these are the factors that need to be considered and deliberated upon. Lastly, I think it was emphasized upon by Mr. Ramachandran and Dr. Sinha as well that community participation, effective mitigation, and I think resolution of investigation related issues become the most important foundations for tackling the problems for such unprecedented situations. So I think that was brief. That was a brief of the panel discussion that happened. So moving on to the last limb of the session, we have questions from our attendees and from the Google form itself to the different panelists. So starting with the questions. Yes. So first, there's a question for Dr. Mudgal. It has been asked by Shreya Jain whether too many laws accentuate the confusion and whether there is a need to frame a set of uniform, proper guidelines to reduce discretion.
I thank you. I think so. Yes, I think there has to be SOPs. There has to be training, and there has to be a system of emergency SOPs if they are not there. If you see, there was a case in Jamia when there were protests going on, and the crowd control uh, was excessive. So many organizations filed RTI applications to find out if there are any laws, any SOPs about how to control the crowd. Are there any norms? And it was very difficult to find an SOP which was prepared by BPRND. And surprisingly, it was a very good SOP, which was present. So I think organizations like Indian Police Foundation, which are like committed completely, to the core, to the idea of, and also universities and colleges like yours, law colleges, etc., they can help in this. But at the same time, if we believe that chalta hai attitude, jo chal raha hai wo theek hai, then I think there'll be a problem. And you would know better than us as law students that Disaster Management Act was followed because it gives the center extraordinary powers over the entire jurisdiction of the country. Okay, and it not only the police but any public servant can file a case, can say that his or her diktat was not followed, and the person would be arrested. So it is and again, when it came to providing compensation, which is a binding thing under Disaster Management Act, the government is dithering. So you want disaster management or you don't want, you find out. So I think in all fairness, let us say, even for the governments, that until a disaster like the health emergency that we saw struck, you would not know how to deal with it. Most countries in the world actually failed in many ways. So yes, I think we need better police, but let's do it now. We have not done it, taking advantage of the time windows which opened in between. But let's do it now. Let's have some kind of groundswell, in support of it.
Thank you so much, Dr. Mudgal. I think it was properly answered. Then another question for Mr. Ramachandran. So, Mr. Murli has asked this question. So, an entire department is found being involved in maladministration or disobeying direction under laws. Then, what kind of accountable? How can we actually impose accountability on such department itself? Is there any legal recourse for that, or what can be the possible solutions to it? So I think you're on mute.
Okay. So there is a lot of, perception like this. I would say negative perception that the entire administration is involved in maladministration. These are very sweeping statements. Yes, there is maladministration. There is a lot of bad things happening, but that doesn't mean that every policeman in this country is like this. In fact, there are very large number of very honest policemen and women in every rank of the police who are doing excellent work. But we also have a fair share of bad characters, corrupt people, people having their own axe to grind. And it is very important that those people are identified and acted upon, acted against. This is a very huge problem. And the story of police reform that we all talk about, is trying to grapple with this problem. Because there are several layers in this of complexities in this. And, the deep involvement of politics in policing makes it all the more complex, because there are officers who are very keen to promote their personal cause, who will, work along with certain kind of politicians and make sure that their own personal agenda is promoted, and at the same time in that process the institution suffers quite a bit, and that has led to this huge erosion in public trust of the police. That is why many people believe that there is a complete breakdown and the entire system is rotten. So these are extreme statements. Now the question, coming back to how to enforce accountability. Even the Supreme Court itself tried to grapple with this police accountability. Before that, the National Police Commissions submitted several reports in which they said that accountability can be, enhanced by these actions. And one of the things, for example, was to look at complaints against erring police officers in a dispassionate way, independently. And that is why the Supreme Court ordered that there should be a police complaints authority in every state. Now, many of you may be knowing that this police complaint authority itself has been completely watered down in most of the states, because there are so many vested interests in our system. And unless I have no magic bullet to offer to raise the accountability. And my own feeling, the only magic bullet I see is when the citizens of this country demonstrate sufficient groundswell that they have had enough. There has to be accountability, not only in police, in every aspect of administration, and especially the police. And that accountability will happen only when the citizens of this country say that enough is enough, and they say that good policing is a promise that the politicians whom they elect should make. Now, as long as they are not willing to combine this with the other issues in policing, in fact, other issues in administration and development, for example. In fact, just before the last 2 elections, the Police Foundation, we tried our best to attract public attention to this, saying that whenever there is an election, the people should demand that police reform should be part of the political, the manifesto of the political parties. We wrote to all the major political parties in this country saying that you include this in your political manifesto, the election manifesto. In fact, I personally know a number of very senior political leaders in many of our important political parties, because I have myself worked in PMO for a long time. So I have personal acquaintance with a number of politicians at senior level. So I personally contacted many of them and said, why don't you include this in your election manifesto? So none of them were willing to touch this. Nobody, no political leader in this country, whichever political party they may belong to, is willing to commit that they will take up police reform, that they will clean up the system, because they want to make use of the police for their own private party interests. So as long as that nexus is promoted, and I would hold the citizens responsible for this nexus, because the citizens have been very ambiguous. They have not been clear in this particular aspect. And unless citizens take a stand and say that enough is enough, there has to be accountability. There can be no accountability. Other things are all, making small little incremental changes here and there. That is not going to help in a big way.
Thank you, Mr. Ramachandran. We have another question for Dr. Sinha. So this question has been asked by Ruchi Sinha. Since there are so varied perceptions on police amongst the common people, do you believe there should be a public relations department in the police system? Or is there any other way to actually check this distrust that has developed between the police and the public?
Most police stations do have a PRO officer. And that PRO officer is the person who actually, जैसे हिंदी में कहते हैं, नब्ज पहचानती है अपनी community का. They know everything about the community. Now the problem is that each of these, most police stations, functionally are divided into 4 parts: administrative, PRO, TDPA, that's externment, and regular processes. Now each of these officers is supposed to be having a team. Each team is compromised by numbers because numbers are taken away for VIP management. So as a result, what happens is conceptually the police station is functioning on a format where they're in touch with the people, but physically they're not being able to do it. So they compromise their activities in the given circumstances. I think the best way to deal with this is the citizens have to take responsibility of knowing their police station. Civics books from the 6th standard should demystify the police station. Who is a station house officer? Who is the police inspector? What can a constable do? What happens is, jo pehle milta hai, usko apni ram kahani sunate. I'm using this word very, very consciously. Now you tell your entire story to the constable, and the constable, after half an hour of listening to you, says, "Ab station house ke paas jao." So the person goes from the constable to the station house that maine police ko story bata di, ab mera FIR ho jayega. Now they do not know that non-cognizable cases, cognizable cases. So there's so many elements of accessing the police station, which nobody knows. But everybody knows that what they expect out of the police. Now, the police cannot, tantamountly respond to everyone's requests. There are limitations. So the best way to bridge this gap, what we have noticed is work on the stereotypes of the police. They have many stereotypes, but also work on the stereotypes of the people. We did a study of 500 people, out of which at least 380 people had no direct interaction with the police, but everyone had opinions. And when we tried to figure out कि ये opinions कहाँ से आए, मैंने सुना था, मैंने देखा था, वो मीडिया में देखा, वो मूवी में दिखाया, and the worst part, गंगा जल का तो opinion सबके पास था. Now, if you're ready to see Ganga Jal, be ready to go to your police station and figure out what it is, or find out a responsible person who can tell you what a police station is, what a police officer can do. So, bridging this gap is not the responsibility of the police alone. We are responsible citizens. We have to have a regular interface. Now, that regular interface does not mean कि हमने जाके police को बोला ये कर दो और वो कर दे. The regular interface is like when we work with the police station, if someone comes and says, ma'am, ye kaam kara do, we don't do that work. We say, this police officer, this is what he will do. This is what you have to do. Go ready with these papers. And I can tell you assuredly, most of the people come back satisfied with the police station. But those people who enter the police station and say, tu janta nahi hai main kaun hu, I mean, you're not giving dignity to the police officer. So it's a dual responsibility. There are limitations in the police station and the police system. But first, do what we can do. And as Mr. Ramachandran pointed out, why don't we come up, all citizens turn around and say, we're sick and tired of the bad police structure that we have. Those manifestos which tell us police reform, ABC will be taken care of, and this is the budget that will be allocated from this financial machinery, I will vote for that person. I can assure you, 30% of our problems will be reduced, 20% with citizens' information, 10% from the police's own perspective. And once all this happens, the police itself will rise up to the occasion. Because don't forget, these police people are equally pained with the kind of feedback they have. 50% of the police officers have become apathetic because nobody listens to them. 20% are struggling to still deliver justice, and 30% I can say that they are corrupt. Okay, so I hope that answers your question.
Thank you so much, Dr. Sinha. There's another question by Nurhevilu. So he has asked whether in comparison to other countries, there's any police system that we could actually emulate in India. And yes, that is the basic question. It's open for any of the panelists.
Can I answer that? You know, I happened to be in Washington, D.C. when this George Floyd thing happened. Okay, I was wrapping up, I was on a fellowship, and I came back right after that, taking an evacuation flight. So when this thing happened, it was, my eyes were opened. You know, I having worked on police reforms, I thought कि यहाँ की police तो बड़ी अच्छी है. यहाँ तो, you know, you have, it's very well equipped, you know. So what actually we have to understand the operational words in police reforms. What do we want? And I take you back to what Mr. Ramachandran said, and I add my bit to that. We don't want just efficient police. We want an efficient and accountable police. Who will fix that accountability? Now, what I saw was that efficiency, it's believed that, you know, हम गरीब country हैं, हमारे पास resources नहीं हैं, बहुत सारे countries के पास resources हैं, their police are very well equipped. You know, the police in America was so well equipped in dealing with the crowds that there were armored vehicles, there were mounted police, there were body armor, there were shields, there were tear gas shells, there is something called stun grenades, there was the assault rifles, pistols, they have something called taser guns, you know, which are like the science fiction guns, you know. They have stun grenades. There are a lot of equipment. And, you know, believe me, when those armored vehicles move on the road, they are like tanks going, you know, it's like a war situation. You know, we don't have that kind of war situation. हमारे बंदे डंडा हिलाते हुए आते हैं, दो चार मारते हैं, चले जाते हैं. You know, like this was a war zone. Who are you fighting against? American people. And something to be said about the crowds. A black person had been killed, and the crowds had more whites in them, than the blacks. So the citizens of America, when they came out, they were Asians, they were Hispanics, they were men and women, they were black and white. So that showed the resolve of the society, that what kind of people came out. And what we saw in the name of efficiency with the police, and what we saw in the politicians. I mean, my God, they were worse than our politicians. The president at that time, he said, when the looting begins, the shooting begins. I mean, it was a very old dialogue from some other century in America, and rather than saying that, you come to your senses and you deal with people in a humanitarian way, they were beating up journalists, knowing that they were journalists. The CNN crew was like beaten up badly. So beating up journalists is not a reserve of Indian police. They also do it. So actually, it'll be best not to emulate them in some of these things. But yes, I mean, they do very good studies. They try to kind of make sense of what is wrong. These as I mentioned, patterns and practices. There are some excellent patterns and practices studies, and the courts, rise to the occasion. So all those things have to happen. But I think my short last point will be that we don't want just very well equipped and efficient police. We want an accountable police.
Right, sir. Thank you so much.
Can I just
a
add
small
one thing?
Yes.
One thing, we cannot emulate anyone, because the kind of diversity that we have in this country, policing that diversity, no other country in the world has been capable or able to do it. So what we need to do is we need to increase our strengths and address the drawbacks that are there. And we will have the best police. And as Mr. Mudgal has pointed out and Mr. Ramachandran has pointed out, that yes, we have resource inefficiency, but human resource is so strong in this country. We can definitely partner and address it. But the political will is missing, and the political will is misusing this system. We have to stop that.
Right, ma'am. Thank you so much, ma'am. Just a small thing, ma'am. We are panelists. We have exceeded a little time, and if the panelists are fine with it, you all could stay and answer further questions, ma'am. If you all are okay. So there, yes.
Another 10 minutes, yeah.
Sir.
I think 10 minutes is okay.
Okay, great. Thank you so much. So there's another question, whether how does the Common Cause team account for sampling errors while collating the results of these surveys? So there are obviously some errors that are bound to happen. So how are those checked?
Radhika?
So yeah, we use a very sort of robust scientific sampling method. And actually, the organization that we've partnered with for the SPIR reports is it's called the Center for Study of Developing Societies, and they've been doing surveys on politics of India for a very long time. They have a research team called Lokniti, which also does the SPIR survey data collection and analysis for these reports. So the sampling methodology is, we have a large sample size. So for instance, in the 10 cities, we usually have at least 200 to 500 samples from any selected location, which in this particular study was at the city level. And the sample selection is done using the electoral roll list. So it is a randomized sampling technique that's being used, and the socio-economic categories are almost always weighted for. So the proportion of SCs, STs, minorities would be in proportion to their actual population in that locality. In this, usually does not need to be done separately through purposive sampling, because through randomized sampling, we get a similar proportion of the different categories. But sometimes in case there is a lesser proportion of, let's say, SCs or STs, we use booster surveys to make sure that the representation of each category is, proportionate to their population. So yeah, that is the sampling technique that we use. And I hope that answers your question, Dev.
Thank you so much.
Thank you so much.
Thank you, ma'am, Radhika, ma'am. So there's another question for Ruchi, ma'am. So Anmol Garg has asked this question. So how can the legal fraternity and the police work together to actually make this process much smoother, and there are no illegal detention, there's no unnecessary beating or violence that acts from the police persons? How can that interplay work?
They can do three things very, very strongly and immediately. One, ensure that the legal aid department works. Okay, if that works, 10% of the marginalized community will get support immediately, right from fighting their cases in the court of laws and also giving them inputs as to how to get their complaints recorded in the police station. They can do both the roles. One, they should not go for tariq pe tariq pe tariq pe tariq. The minute they do that, the police officer who has to leave the police station to give evidence or whatever role they pay there, it reduces the efficiency of the police station. Make it very professional. Within 5 sittings, within 10 sittings, you have to be able to reach a certain milestone in the court of law. And last but not the least, the lawyer fraternity has to understand that if there is lack of accountability in the police system, there's lack of accountability in the judicial system also. You know how many lawyers are there out there supporting the criminals and not fighting for justice. We need more lawyers fighting for justice. I think if this is done, I think our judicial system will rectify. There's self-correction possible.
Thank you, ma'am, for such a precise answer to that. Ma'am, another question by K. Srivastav. So we understand that there are problems in how the police are trained, how there are loopholes in policing as well. So what should be a course of action? Should be prioritized, whether sensitization, whether need of training, or what should whether community participation should be prioritized first? So how should we go about it? Mr. Ramachandran, if you may.
So training is a huge problem in police. The Indian Police Service, IPS, they get very good training, fairly good training. And it is considered one of the best training institutions in the world, the National Police Academy. But, training in most states in India, most states, I'm saying this very, consciously, is very poor. In fact, I was shocked to see after a long deputation in Government of India, when I went back to my state, I went to the training academy and asked them to show me the curriculum for sub-inspectors training. The gentleman in charge, the director of the training institution, brought a one-page typewritten syllabus, which must have been typed 25 years back, and said, this is the sub-inspector's training curriculum. So I was really shocked. This was in fact one of the reasons why I thought about starting this police foundation, because there is no application of mind when we, in many states, when we do this training curriculum, design. It's a huge problem. Of course, states are changing. There's a lot of change that we are seeing over the years, a lot of change. But the fact remains that police training is by and large designed, even the culture is designed for, the colonial kind of training with, 30%, 40% of the time on, drills and parades and, weapon training and things like that. And very little, inputs on the current issues that are plaguing the police. For example, many states even now, for example, when they talk about computer training or cyber training, etc., they have a very omnibus kind of training, giving about a week in a week, about 1 day in a week is given for what passes for computer training. That doesn't really mean anything. Actually, today's investigation of cases, investigation of crime is mostly, crimes are resolved through forensic or digital forensics, or by analyzing the digital footprints that are left behind by the criminals, or by analyzing, for example, call data and things like that. All this require a different kind of training, and the traditional kind of police training is not going to help. And so training has to be a very dynamic thing, and every day the trainers should be thinking about what is the police required to do today and tomorrow, because we have to train for tomorrow also, not only for today. And that kind of dynamism in training is required, and that will require a lot of resources. I would say this is one area where resources are very, very small as far as training resources are concerned. And when we talk about resources, let me also tell you, for information of everyone, I was myself a DG of police. In most of the states, whatever money we get as our annual budget, 95 to 98% of that money goes for salaries. It is with the 2%, in poorer states at least I am saying, it is with that 2% that we have to buy vehicles, we have to run the the vehicles, that is petrol, you have to buy, you have to pay electricity bills, all those kind of things, and also find money for housing and modern equipment, etc. So there is very little resources available, and training becomes the least priority for even for DGPs, because they have very little resources left. And it is only where there are very forward-looking officers who have the time and inclination to look at policing in a police training in a very very well thought out manner. Only in such places we have seen there has been. And again, as somebody mentioned, many of the southern states, as well as some, of course, Delhi, etc., have done well. Punjab has done very well in improving training facilities. And it is not only about building training infrastructure, it is also about designing the curriculum and also having training, resources, means resource persons, because we, in many states, again, for your information, police officers who are posted to the training centers, they believe that they have been sidelined. At least some police officers believe like that. So the instructors also believe like that they have been sidelined. So that is why they have been brought to this. So that as long as that mentality is there, training itself is not going to improve. In the armed forces, for example, it is the best officers who man the training academies. But in the police, generally, the feeling is that training, posting in training branch means it is a sidelining, and that is a sidey job. So as long as that mentality remains, things are not going to improve. So one is resources, so financial and other resources, infrastructure, and the other is about a lot of attention that is required for curriculum building and faculty resources.
Thank you, sir. Thank you for such an elaborate answer onto that and a candid answer, so to say. I think we have come to the end of this panel discussion. I thank Radhika ma'am for deliberating on the SPIR report and the three panelists for such an enriching session and enlightening session for all of us. It was really an eye opener for all of us to see the police perspective on this whole issue and how citizens perceive and what are the different problems that the police face that people need to understand before critiquing unreasonably, if at all, that may happen. So the perspective needs to be understood. There were a lot of lessons and learnings from this session itself. And in view of that, I feel a report needs to be prepared. And RSR will also do a transcript for this whole report. So that will be available on our website and on Common Cause's website as well. So I think this brings to the end of the session. I'm really thankful for Common Cause to partner in this panel discussion and allowing this enriching session for all of us. Thank you so much. If you have anything to say, Radhika ma'am.
No, that's it. Thank you so much, Aditya, and thank you to your team for organizing this wonderful discussion. It was great to be participating in this.
Thank you so much. Thank you all.
Thank you, Aditya. From the
Thank
side
you.
of the Police Foundation, I should offer to all the members of your organization that they are welcome to contact us if any of the students are interested in doing an internship with the Police Foundation. We generally have a lot of interns from law institutes in the country.
That will be great. That will be great. Thank you so much.
Yeah.
Okay. Thank you so much. Thank you so much, everyone. Thank you for attending and giving your precious time.